So ticks transmit a number of pathogens in Wisconsin. The tick that we mostly worry or wonder about and think about when it comes to transmitting pathogens is the black-legged tick or the deer tick. So the deer tick is known as Ixodes scapularis. That's its scientific name. And we know that Ixodes scapularis, or the deer tick, transmits Lyme disease. It transmits anaplasmosis. It transmits ehrlichiosis. It transmits babesiosis and a more rare disease called Powassan virus. So all of those, when you first become sick, have kind of similar characteristic features: fever, achiness, headache, symptoms of a bacterial or a parasitic or a viral infection. So they're all pretty similar in the early onset. Lyme disease, in some cases, not all, but many, also is accompanied by a characteristic bullseye rash called erythema migrans. And so that's a very classic symptom that sometimes people will get and, should immediately bring somebody to seek medical attention. Lyme disease also, if untreated, can result in other symptoms like neurological symptoms, severe joint pain and achiness. Seeking medical care in the summer, if you've had a tick exposure, tick bite, and you start to develop these symptoms is really important. The longer you would wait to seek care, the less likely you would have a good outcome. There's another tick, the American dog tick or wood tick. That is a tick that probably most people are familiar with. It's a much bigger tick than the deer tick. And so we see that quite frequently. In Wisconsin, that one isn't known to carry diseases frequently. In the western part of the United States, it can carry some diseases, but we don't typically see a lot of disease associated with that tick in Wisconsin. One of the ticks that is sort of been in the news a little bit more is a tick called the Lonestar Tick. And it's not named the Lonestar Tick because it comes from Texas. It's more native to the Southeast in the Carolinas, in that area. But it's called the Lonestar Tick because it has a white dot in the middle of its back. And so that tick is making its way north and west in the United States. And so last year we did some tick studies and we found that tick in Wisconsin. It's not native to Wisconsin. We don't know if it's endemic or it will become endemic. So it's an introduced species, but we don't know if it's going to establish itself because it's more characteristic of a warmer climate. But as the climate changes, it could find itself some places where it could overwinter. So that tick is really interesting because it causes a disease called alpha-gal syndrome. So alpha-gal syndrome is a meat allergy. So when the ticks are attached and feeding, they inject into the host a sugar, and subsequently those people have a meat allergy, so they can't eat red meat. So that's one that people really, it can be pretty devastating to somebody who, enjoys red meat. But I think it's a good message why we should keep doing research and work on tick-borne diseases, because the climate's changing, ranges where ticks is changing, and we want to do research so that we can also inform care and outcomes. And so helping people be healthier is really important.